Hello friends, sometimes the preterm babies, especially who are sick, may require the platelet transfusions. In this webinar, we will learn about the details of platelet transfusion in preterm babies. Even though the preterm babies require the platelet transfusions less often than the packed red cell transfusions, but whenever they require, appropriate guidelines should always be followed. Here we will understand what are the guidelines to be followed for platelet transfusion in preterm babies and what procedure should be used for giving these platelet transfusions in preterm babies. So now friends, let us learn when we should transfuse the preterm babies with platelets. The table in the slide describes the guidelines for transfusing the platelets in preterm babies. Now let us understand how one can follow these guidelines. To appropriately follow the guidelines, one should first determine if there is any bleeding associated with the low platelet counts by a detailed examination. The preterms who are bleeding should be transfused when the platelet counts are less than 50,000. However, if the baby has a major bleeding or is planned to go for surgery, it is advisable to transfuse even if the levels are less than 1 lakh. Vis-a-vis, the preterm who does not have any bleeding only needs platelet transfusion when their platelet counts are less than 20,000. Now once we know when to give platelets to these preterm babies, let us now understand some important considerations during platelet transfusion. Platelet transfused need not be cross-matched unless it is a refractory case. The platelet concentrate should be given at 10 ml per kg. It is very important to transfuse the platelets immediately as soon as it is received from the blood bank, as they have a very short half-life. The rate of administration of platelet transfusion should be over a duration of 30 minutes. The baby may continue to feed during the transfusion. The maintenance fluids may be withheld during the platelet transfusion, which can be restarted after the completion of transfusion. Thank you.